medication preparations, and supplies. We will start with the non-traditional types of preparations. The first is the Transdermal Delivery System and implantable devices. They are used for their easy application, effective for long periods of time, and they are consistent in the blood levels. Some examples of transdermal delivery systems are fentanyl and lidocaine patches. These are mainly used for pain. And then we also have the ortho-evra patch, which is used for birth control. Some examples of implantable devices are the Nexplanon or Implanon, IUDs. Both are for birth control. And then there's also the Nexplanon or Narcan implantable device, usually implanted in the lower abdomen to help people with addiction type diseases. Standard drug forms, we have tablets. Most common, they come in scored or unscored. Only scored tablets should be halved. They should never be quartered. It can often be hard for patients to quarter tablets, and also the consistency and the amount of drug is usually compromised. Unscored tablets should never be split. Enteric-coated tablets. Enteric-coated tablets dissolve further down in the GI tract, mainly in the intestines. A good example of an enteric-coated medication is aspirin. Enteric-coated aspirin is usually taken by patients who suffer from stomach issues due to aspirin, stomach irritated stomachs, or ulcers. Enteric-coated tablets should never be split because they have a special coating that helps them make it all the way down to the intestines to be dissolved. Capsules cannot be split in half. Sustained release, also called delayed release, delivers the drug consistently over 12 hours or 24 hours, depending on the drug. They should not be crushed. Some examples of this are Topical XL or Emder. There are many, many drugs that are sustained release. Standard drug forms. So lozenges or troches, it is important that they dissolve in the mouth slowly. You should not drink up to 15 minutes after taking these, and you should not swallow them. Suspensions. The main thing with suspensions is to shake them well. Usually the particles settle at the bottom, so it is important to shake well to make sure that the medication is evenly distributed through the container. A good example of this is cephalexin or antibiotics. Usually are suspensions. Emulsions contain oil and fats in water. They are liquid. Elixirs are sweetened aromatic liquids used for compounding oral medications. Tinctures are liquid extracts made from herbs with an alcohol base. And then syrups and solutions. Solutions are drugs that are totally and evenly dissolved. The appearance of these is generally clear, versus our suspensions. Usually they have a hazy look, a white colored look, especially with our antibiotics. So that's how you tell the difference between the suspensions and the solutions when looking at them in the clinic. Rectal drug forms. So we have suppositories, which are solid or semi-solid medications inserted into the rectum. Enemas are liquid form of the drug inserted into the rectum. So you will want to know the difference between these two. They are often given to patients MPO that are MPO for surgery and should never be swallowed. Many times laxatives are given to elderly either by suppository or enema. That's another example. And antiemetics, if patients are throwing up excessively, sometimes we will give them a suppository or an enema of a certain medication to help suppress those symptoms. Injectable drug forms. So there's liquid and then there's powder. The powder typed medication, some of our vaccines come this way, are reconstituted with liquid forms, either sterile saline or sterile water. Topical drug forms, there's cream, which is water-based. Ointments are oil-based. A lot of times we will have eye ointments, but they can only be administered into the eyes if they are labeled sterile for ophthalmic use only. So that is very important to instruct patients. There are different lotions. Liniments cause a tingling or burning sensation when applied to the skin. Dermal patches we talked about a little bit earlier. Douching solutions irrigate the vaginal canal. Buccal and sublingual tablets. Buccal and sublingual tablets is very important that we do not swallow. Sublingual is preferred over the buccal tablets. Sublingual tablets go under the tongue and we wait for them to be dissolved. Our most common type of sublingual tablet is the nitroglycerin tablet. Inhaled drug forms. We have sprayed, which is our metered dose inhalers, and then we have our mist, which is our nebulizers.